Common viral infections. Virus is tiny infectious agent made of genetic material inside a protein coating. It need living cells to reproduce or replicate. They enter human cell and multiply and replicate using these cells, and make people sick by destroying the host cells. Viral infection is a health condition or disease caused by virus. The severity of the infection may be different in every person. People with strong immune system show less symptoms, whereas people with weak immune system show more severe symptoms. Virus and bacteria both are pathogenic particles that cause disease in human body. Virus needs host cells to reproduce or replicate, whereas bacteria has capability to reproduce on its own. Sometimes, the symptoms of both the conditions can be same. Lab tests are done to confirm the cause of the infection. Virus can transmit from one person to other in various different ways. It can spread by contact of sick person, saliva, air, sexual contact, contaminated needle, vectors like ticks and mosquitoes, and contaminated food and water. Viruses can affect different systems and parts of the body. Some common types of viral infections are influenza, human immunodeficiency viruses, pneumonia, herpes, chickenpox, rotavirus, human papillomavirus, and meningitis. Respiratory viral infections affect nose, throat and lungs and transmitted by inhaling droplets that contain virus particles. Examples of respiratory viral infections are rhinovirus, seasonal influenza, and respiratory syncytial virus. Rhinovirus causes common cold and shows symptoms like sneezing, coughing, mild headache and sore throat. The symptoms usually last for 2 weeks. Seasonal influenza shows severe symptoms than cold, including fatigue and body ache. It comes more suddenly than cold. The respiratory syncytial virus causes both upper respiratory and lower respiratory infections, and is severe in elder person, infants and young children. Viral skin infections are the skin infections caused due to virus. The infection can be mild to severe. Example of viral skin infections are herpes simplex virus 1 and varicella zoster virus. Herpes simplex virus 1 cause cold sores. Sometimes it can also cause genital herpes. Varicella zoster virus, it causes chickenpox and herpes zoster. It shows symptoms like high fever, fatigue, itchy and oozing blisters. Chickenpox is common in children, whereas shingles is common in older people. Foodborne viral infections are the common cause of gastroenteritis and food poisoning. Hepatitis A and E, rotavirus and norovirus cause foodborne infection. Hepatitis A and E causes inflammation of the liver. It shows symptoms like nausea, diarrhea, yellow skin and vomiting. Rotavirus causes gastroenteritis in young children. It shows symptoms like severe diarrhea. Norovirus is the most common foodborne viral infection. It leads to gastroenteritis condition showing symptoms like vomiting, nausea, diarrhea, and abdominal pain. Sexually transmitted viral infections spread through vaginal intercourse, oral sex, anal sex or skin-to-skin contact. Examples of sexually transmitted viral infections are herpes simplex virus 2, hepatitis B, human immunodeficiency viruses, and human papillomavirus. Herpes simplex virus 2 causes cold sores or genital herpes. Hepatitis B causes inflammation in the liver. It may show no symptoms or symptoms like flu. Human immunodeficiency viruses affects the T cells of immune system. It decreases the body's ability to fight against infection and diseases, which results in acquired immune deficiency syndrome. Human papillomavirus is a common sexually transmitted infection. It can lead to development of genital warts or increase the risk of cervical cancer. Viruses can lead to other infection that can be mild to life-threatening. Epstein-Barr virus is a type of herpes virus that causes fatigue, swollen lymph nodes, enlarged spleen and fever. West Nile virus is mostly asymptomatic, but some may show symptoms like headache, fever, and other symptoms. In rare case, people may develop encephalitis or meningitis. Viral meningitis is mostly caused by enteroviruses. It causes inflammation of the lining of the spinal cord and brain. It shows symptoms like fever, headache and stiff neck. Most of the viral infections subside on their own. If required, supportive treatment is provided to relieve the symptoms till the virus is eradicated. Antiviral medications can be given to prevent the virus from replicating. However, they work effectively if given in early stage after the exposure of the virus. Antiviral medications may be used to treat infections like hepatitis C, influenza, herpes simplex, chickenpox, shingles, herpes simplex virus 1 and human immunodeficiency viruses. Viral infections cannot be prevented, but some measures can reduce the risk of getting exposed to the virus. Measures like getting vaccinated, maintaining proper hygiene, avoiding contact with sick person and sharing personal items can prevent spread of viral infections.